Well, welcome to everybody. We started these podcasts as COVID began, and I don't think we realized that we would be, today is our 70 something forum. So we are glad to do that. We always say whether you have a perfect attendance pin and have been at all 70 something forums, or this is your very first one, we are so happy to have you. There are forums and then there are forums. This is a big day for us, and we hope a big day for the kids of Kentucky, because we're going to be talking about our 2022 agenda for the Blueprint for Kentucky's Children. Joining us today is House Minority Leader Joni Jenkins. And in just a second, I'm going to introduce our first guest to you. Just a reminder, because in looking at the screen, some of you are eminently involved in developing the blueprint, and some of you may be joining us for the first time. So I just want to remind you that the Blueprint for Kentucky's Children actually is a response to a request we got maybe 12, 14 years ago from legislative leadership, which is build a minimal, focused, and consensual agenda for kids. What we heard was that as elected leaders, they can't deal with 200 ideas from 200 people. And they challenged us to coalesce, synthesize, and give them an agenda that has prioritized policies and feasible priorities. The track record has been really positive and very profound, because legislative leaders in both chambers, both parties, have been delivering for kids. And I just want to emphasize that our appreciation to the General Assembly for being a real voice for kids. So we wanted today to begin with a little bit of a deep dive with two key leaders. As I mentioned, Representative Jenkins is going to be joining us at about 10. She's on the call, but we're going to be talking to Joni at about 10:30. But to open us up is Senate President Robert Stivers. So, Mr. President, thank you so much for joining us today. We're always very, very happy to have you. I'm going to start. I just finished an article. I'm not, Mr. President, I'm sure this will surprise you, but I'm not an art guy. I barely know what the Mona Lisa is, but I just read an article about visual lethargy. And the concept is that in the world we live in today, we are so overly stimulated that whether it's looking at a work of art or a sunset, we tend to be immune to wonder. And I just really need to say that I want to make sure that we don't have leadership lethargy, because you have been so important to Kentucky's kids for so long that I want you to know that we do not take that for granted. We do not fall into that trap of the president will take care of this. Every year, we dialogue with you and leadership, and you give us great advice, and then you deliver. And I just need to kind of publicly say how much we appreciate your voice and your lever when it comes to kids. So thanks for that.
Appreciate that, Terry.
We're going to jump into some policies, but there is no way that I ever talk to you that I don't ask you to begin with the same narrative, because I think your summary of why you do what you do, how that is a legacy from your mom, I think more than anyone. I just think that's so profound. And I want to make sure that everybody on this call kind of gets a frame of who President Robert Stivers is and what drives him. So I just ask you to riff a little bit to share with folks, why in the world do you do what you do?
Well, that from day to day, that may change, Terry. But no, you speak of my mother, and I just finished a Zoom call. My mother was born and raised in Massachusetts and did her undergraduate work at Simmons College in Boston, then her master's at Harvard in the 40s, which was unusual for a woman to do at that time. Left Boston sight unseen in 1946 and came to Southeast Kentucky as a master's level dietitian to work with Frontier Nursing Service, which was known for the midwives and the practice and the art of midwifery. and she was working with post and prenatal care for appropriate diets for these women and working with these nurses. So there would be better healthcare outcomes for the children of Eastern Kentucky. So I always say, if you want to know what real culture shock is, go from Boston, Massachusetts in 1946 to Oneida, Kentucky, having never been there before, to do what she did. And she did that. And now that's 70 some years later. I'm working on various things to change healthcare and educational outcomes for children of the area and the state. So, and that drives me. I'll say this too. I use this analogy. My road of life is pretty well blacktopped. I know what it's going to be like when you're getting ready to hit 60 years old, a few potholes and speed bumps. But what we have to do is really kind of create a better road for those children, so they don't have as many potholes and speed bumps in their road of life. And that, as a policymaker, is really what we should be looking forward and looking towards, is how we create better healthcare outcomes, better educational outcomes, better socioeconomic outcomes for our kids.
Well, and we appreciate what you do on that. And you just set up sort of my opening question. I think week before last, Senator Givens actually had given us an opportunity to testify before the Commission on Race. And he and Representative Heverin and a number of other folks did such a great job of talking about economic well-being for Kentucky's kids. We know that the overall trend line is positive when it comes to childhood poverty, and yet we know that certain groups of kids in Kentucky are really stuck in the morass of childhood poverty. I'm fascinated by the fact that the kids in the 6 poorest counties in Kentucky, all, as you know, in Southeast Kentucky, and Black kids in Fayette and Jefferson County, those groups that seemingly are so different have an identical childhood poverty rate of 40%. I mean, that's almost 1 in 2 kids in Southeast Kentucky and minority kids in Fayette and Jefferson County living in poverty. You've always been somebody who talks about the importance of economic well-being, how it impacts every other facet of a kid's life. As we look at the General Assembly coming into 2022, federal dollars, policy opportunities, a state budget, can you talk about your thinking at the moment of how we as a state can continue to attack that plague of childhood poverty?
2 areas, and they're kind of linked by one issue that we want to make sure we deal with appropriately. Healthcare and education, which both can be enhanced. And I think everybody knows this, and this is one area we have very much agreement with the governor on, is dealing with broadband, especially more so maybe in the rural communities, but you'll still find, and some people will find this interesting, that some of the poorest connectivity happens to be in downtown Louisville. But that can help it's both the healthcare outcomes, which link right into healthcare outcomes, directly reflect on educational outcomes. And to change both trajectories of children is significant in changing the status of those children who live in poverty. And I've said this, you can talk about different things about criminal justice, and you can talk about race, and but if you want to see the common thread when you look at who's incarcerated and where they came from, and this is not in totality, this, you think about a bell curve of probability if you're a statistics person, but the majority of the people who you see that are incarcerated are those who came from areas that had low socioeconomics, low educational attainment levels and poor access to healthcare. So if you can change those, it doesn't matter if you're rural or urban, black or white. We want everybody to have good healthcare, good education, good job opportunities, and then creation of wealth, and pass that on to your children. And leave your little part of the world better off for them than when you found it.
Okay, thank you. And for our participants, I saw in the chat, and again, we would encourage you to drop comments or questions into the chat, and we'll try to respond to those. At the end of this, we're going to begin talking, obviously, to President Stivers and then to Representative Jenkins. We're going to wrap this up with a detailed look at policy. So taking what the president just said, you're going to hear us talk about, for instance, some targeted tax proposals that we hope the General Assembly will entertain. So I want to make sure you know we're going to get specific. Mr. President, you set up really the next set of questions. I was going to do this a little bit later, but it fits so perfectly. Believe it or not, Mr. President, I put the names of every participant on this call in a hat. Shockingly, I drew out Jennifer Hancock's name to ask the next question. So if Ms. VOA can jump on. Jennifer, first of all, congratulations for your name being randomly pulled. I'm just guessing you might have a couple of questions for the president.
Indeed, I do. I think I'll play the lottery later today. I've never done that, but today sounds like it's my day. Good morning, everyone, and thank you, President Stivers, for being here. I want to first start by saying that if I can state the obvious, you have one of the most powerful and influential voices in the Commonwealth, and I want to thank you on behalf of all of us for using that voice to lift up issues that are affecting our Kentucky kids. You and Terry stood with me and others 2 weeks ago as we announced an innovative new partnership between Volunteers of America and DCBS that will, I believe, improve outcomes for kids to be with their parents and to address the issue of addiction together. So I want to thank you for that. But I do have a couple of questions for you this morning. And you did tee this up rather nicely. This first one is as follows. So for kids age 12 and younger, more than 2/3 of complaints against them are status offenses like missing school or running away and other misdemeanors. We believe these can be effectively addressed within the community instead of courts. By utilizing school-based interventions such as restorative justice, this is an age-appropriate intervention that responds to kids' misbehavior in schools and ensures young people are held accountable for their actions, and it keeps them from entering the juvenile justice system. So the question is this: does the General Assembly have the appetite to start small with pilot projects within school districts on a voluntary basis? Or at this point, should we as advocates approach this opportunity to take restorative justice practices inside school districts in an all-in approach? So give us your thoughts regarding, do we go take this incrementally and work with schools voluntarily, or do we just go all in and take restorative practices within these schools?
Well, thank you for the question. And I'll say this, I think you have seen a pretty big shift in the last few years of the legislature's emphasis, much of it led by individuals like David Meade in the House. You're seeing members in the Senate like Chris McDaniel and now Matt Caslin, Whitney Westerfield, others who have adopted children, looking and thinking about systemically what we have and what, for lack of a better term, I can break out my little what it is that we use to deal with those 12 and under who have some type of status offense. The one thing you don't want to do is stigmatize a child that they are a criminal at 10 years old. So as to your question on restorative justice and programs, Is there an appetite? I think there is an appetite. I think there is a very big appetite to change what our system is now, because we don't think it's very good. And we're still trying to find what that substitute is. And it may be restorative justice. I know you're performing and working, you and Terry both, in Jefferson County and some other areas, to show how it has worked, and get quantifiable data to show that it is results, that it gets the results and is results oriented. So the long and short of your question's answer is yes, there is an appetite, a very big appetite, because we think let's just be candid, we think we have a flawed and failed system right now in many aspects. But there is also when we get to the adoption process and termination of parental rights, there is a balance, and that's all part of this calculus as to what's the right balance between termination and reunification of children and removal from homes. But yes, I do believe there is that appetite, but what is the new model I think everybody is searching for. And I think that the restorative justice can be a component, as we've talked, Jennifer, about show us the quantifiable data that it does make a difference. We want something that is theoretically solid, and has good outcomes that can be proven.
Thank you for that. I want to also affirm and appreciate the comment I just heard you make that 10-year-olds should not be charged criminally. I think my colleagues on this call and I absolutely agree with you on that, which leads me to my next question. We're more likely to see better outcomes for public safety and for young people if we refer them to age-appropriate community-based services that can assess for and address the underlying issues that they have. In fact, we've seen states like Arkansas and Utah pass legislation to raise the minimum age that they can be charged over these past few years. Is this the year we will see productive and meaningful conversations around establishing a minimum age of at least 12 years old that a child can be charged criminally in Kentucky?
Well, I guess it would all depend. And again, thank you for the question. It would all depend on what you classify as productive. If that means getting a statute change, it may or may not be productive. Having further discussions and having legitimate discussions on what should be done, I think, as I answered the question before, we are searching as a policy making body as to what the right course of conduct is for this population, a very fragile population, a developing population, and you well know that, and how to deal with it. There is, and for most people who need to know this, I've practiced law for 32 years, and I've been in some very tough cases. I'm one of the few people probably in the General Assembly, if not the only one, that has tried multiple death penalty cases, and defended and prosecuted multi-state and international drug conspiracies. So I don't know if what the sentiment will be about creating bright line rules, because you can have some children who are not very sophisticated and 17 that will have and can be outperformed and very much more knowledgeable and savvy, both in street level savviness and other ways, as to how things work that are 12. So the discussion part and how to deal with this is something we're always talking about, whether it is beneficial and as you described it earlier, I don't know. That's all matter of perspective on where you are and what the outcomes are. If the outcomes are what you want, they're probably considered what you think they are. If they're not, then it may be a different question and a different answer.
As a quick follow-up, knowing how data-driven you are, and I think that philosophy of decision-making is shared by many of us on this call this morning, that we want to see the data to influence and inform policy. Do you think it helps to bring forward to the General Assembly some science around brain development amongst youth, and that the executive functioning at age 12 and younger is just not developed in such a manner that we can reasonably hold kids accountable criminally? So is it that, or is it some other data set that we need to bring forward to have a more convincing argument as we engage in this type of advocacy?
I think that data set is a very good data set, but I don't think it should be the sole data set. And again, from your background and Terry's background, and it's not my background, but it's what I've learned. You know, the brain development still continues until the age of 25 in most circumstances. But that's, again, the bell curve of probability in most circumstances. Some brain development may be completed by 20, some may not be completed till 30. So, you know, what the brain development is at age 12 is going to be totally different in outliers and based on environmental circumstances. And some people on this call may not like this position that I take. I am not an advocate for legalization of marijuana because it adversely impacts brain development, and more so in youth. So I understand the medicinal value if needed, but there's medicinal value in a lot of drugs, but you shouldn't be taking them every day. So you have a very valid point, but I don't think it is a singular or sole determinative of what we do.
Thanks for being with us today.
Yeah. So, Mr. President, thanks, Jennifer, and I'm so glad that I randomly chose you because you seem like you were really well prepared to be surprised.
I know it. I kind of wondered about that, Terry. I love the random draw and 3 questions that get thrown
just good on my feet. Come on, I'm good on my feet.
Yeah, it just happened. So, Mr. President,
I'm looking at the screen. Everybody's laughing at that one, Terry, thinking that was a random draw.
So, your office has threatened me if you're not off at 10:30. So it looks like I've got time for one more question. What I love about the General Assembly of late is y'all have taken on big issues in big ways, in bipartisan ways. Juvenile justice through SB 200 a few years ago, big accountability assessment changes, the school safety and resiliency bill. You've referenced Representative Mead and Representative Jenkins putting together some fundamental child welfare reform. As we go into 2022, do you have an inkling, a prediction, or a hope as to a big policy arena when it comes to kids and families that you think you all are teeing up for big reform this coming year?
Well, I'm going to say this, and it may not be something as to a policy reform as to implications on the service group being children, but it may be looking at how we totally deal with our cabinet and the services and how they provide those services to the constituency that we're talking about. We think we probably have some good policies in place, but we just don't have enough people. Or do we have the right pay scales to attract the quality of people to deal with this booming or plethora of issues? And I think it is greater today than it was when I was younger or when my kids were younger. But so we're really discussing about how we create a quality workforce. And I'm not disparaging anybody that's there, but when you have a need for 70 frontline social workers and only have 20, that's a big issue. because you can't deliver the services. I don't care if I'm going to pick on Jennifer right now. Jennifer can come to me with some of the greatest policies in the world, that we can have restorative justice, and and the program that was announced with you, Terry, the other day. But if there is not the workforce behind that to deliver the product, what does it make a difference what the product is if you don't have the workforce to deliver it? And so that's one of our big considerations now, because COVID has shown that we have some real problems within our workforce that is working in this area.
Thanks. Well, Mr. President, I want to honor your office's strong suggestion to get you off. I want to reiterate my appreciation, not just for you being here today, but what you've done for so long when Kentucky Kids Come. Really, the only final thing is, I know, I think your birthday is one day before mine, and your birthday, I believe, is Christmas Eve. So I just need to say that you really depressed me when you said you were approaching being 60, and I can't even remember back when I was. So other than that downer, I appreciate you being here. I don't know if you've got time for just a closing benediction from your perspective. The one thing we try to emphasize to folks, and I know you do that, is so many folks on this call have to wonder, does their voice matter? How can they let their senator know what they're thinking? Can you kind of give us a final thought on a call to action for everybody on this call? And then I'm going to get you off on time.
Terry, that benediction, that's interesting way to determine what I'm going to say. But, I'm going to say this. Truly, I think the legislature over the last few years has really changed its focus in this area, hopefully for the good. But I will also say this, it doesn't do very well to just look at your legislator and think that your voice matters if you just say the system is broken. There's problems with the system. We all come from different backgrounds. And so what helps us is, yes, tell us there's a problem, but give us some ideas for solutions. And when you can come to the table or bring to us the problem and potential solutions, that's very effective in the way you get change. So I would, and it's very effective to be it one person or a group of people that are collaborating together to come with the problem and solutions, because it does no good just to say for the legislature, there's a problem out here, now fix it. We're not on the ground. We're not seeing that. And I'll equate it to my role as a lawyer. Don't ask me to build your house because I don't know how to. That's not my daily routine. But if you want a deed to sell your house, I can deal with that. So individuals who are working in the area of dealing with youthful problems, they see it, they know it. They know what the problems are, they know potential solutions. And so when you're advocating, bring both the solution that you have attached to the problem.
Okay. Mr. President, thanks so much for joining us. Again, that we appreciate all you do for Kentucky's kids. Have a great rest of the day.
Thank you, Terry, and I hope everybody has a great holiday season.
Thank you. So we want to pivot. As I said, the president has to jump, and he's jumping off, and Joni Jenkins is jumping on. So it looks like Joni has brought a guest, and so we have even more folks here. Representative, thanks so much for joining us today.
I think Kalinda the cat enjoyed President Stivers' voice. She came running up.
That's good. So for our participants, I want to say three things about Representative Jenkins. First of all, she was actually in the room when the blueprint was born, because she was one of the folks who said to us a long time ago, you guys have to, she didn't say it quite like this, but you all have to get it together. You've got to decide the minimal, consensual, common ground ideas that you can bring us. And so in many, many ways, Representative Jenkins was an architect of the blueprint. Secondly, whatever her role has been, she always gives voices around kids incredible access and incredible coaching, and we appreciate that. In a relatively new role, minority leader of the House, I'm reminded that John Meacham, who I think is about as good of an author as there is thinking about American politics, has written a fascinating treatise where his hypothesis is that historically through American history, the minority leader in Congress has inevitably been a catalyst for big changes. He goes back to early 19th century all the way through the Obama administration, and builds a case that when minority leaders take their role seriously, they affect enormous change. And I think Representative Jenkins understands that. She, not we, dubbed the phrase that she's not the minority chair, she's the super minority chair. And yet, you know, she doesn't approach it like, well, what can we do? Instead, she is a very, very effective and influential voice. And Joni, I just, need to say how much I appreciate your role in that.
Well, thank you. It's been an interesting ride.
Yeah. Well, we're gonna jump into specific policies because I want to get your take on some areas. If there is an area that I perceive the House Minority Caucus actually leading the conversation with majorities in their chamber and the whole Senate, it is around early childhood. And shockingly, and very coincidentally and fortuitous, I've done a second random draw. Mandy Simpson, you won the prize. So, Mandy, can you think on your feet of a question or so that you'd like to pose to Representative Jenkins?
Well, I will certainly try. And Leader Jenkins, it is a prize indeed to get to be speaking with you this morning. Thank you so much for being with us. And thank you for your leadership on this issue. We've already gotten to proudly stand by your side as you have helped us navigate conversations that really center our youngest children and their families and help us move them forward in their ability to thrive. So I'm spoiling my lead a little bit here, but as we do head into the 2022 session, we are facing a challenge, a mighty one, that is impacting everyone from our smallest children to our biggest businesses. And indeed, it is the lack of access to quality childcare. But fortunately, we have undaunted leaders like you who recognize this crisis and the power that our legislative leaders have to overcome it. So now, knowing that more than half of Kentucky counties were childcare deserts before we ever entered the pandemic, we've lost at least 8% of our childcare sector across the state because of the pandemic. And that number, unfortunately, grows and shifts and moves and impacts various communities up to 15% losses throughout the Commonwealth. And on top of that, and because of that, we have 40% of working age parents citing care responsibilities as their reasons for not working, and our businesses struggling to have the workforce they need to keep their doors open and their operations running. So with that in mind, where do strategies to support our early childhood ecosystem, which of course includes childcare, includes our public pre-K, and includes equipping families with what they need to be our parents' first and best leaders and educators, where do these priorities fall for this session, and what proposals and investments have the best chance of success?
Well, thank you for that question. And that is something my caucus has been really targeted on. And we've had big discussions. And in fact, I am leaving here soon to go meet. We're having our annual retreat. And one of the big things on our agenda to talk about is with budget surpluses, with federal money, how can we best position Kentucky to get the best bang for their buck, to make a big, bold investment. And, without, predicting what the caucus is going to decide, I think it's going to be around early childhood development, education, and childcare. COVID peeled back a lot of layers that were already there, but not at the forefront. And childcare is one of them. And I think while people are saying, unemployment and stimulus were too rich and people don't want to go back to work, people have figured out that it doesn't pay them to go back to work when childcare is so expensive and good quality childcare is so expensive. So I think we need to take these lessons that we've learned from the pandemic and go forward. And I think I tell my colleagues all the time on both sides of the aisle, every state in the union is getting lots of federal money. So we're all going to be competing against each other with big business interests about who made the best investment. And as people are looking for places to come and invest their businesses, they're going to judge us on how we took this opportunity and what we did to make an investment that's going to last for years and years. And I think that's early childhood development. I think it's quality childcare, it's quality pre-K and all-day kindergarten. We know that to break generational poverty is a huge, huge task. But one of the ways out of that is through early education, getting kids on the right track immediately, and allowing their parents to be able to work at meaningful jobs. So I think you will see from the House Democratic Caucus, of which I always say we're the super duper minority, but boy, we don't act like it. And we punch above our weight every single day. Much of that due to the fact that we have 17 female representatives who many, if almost all of them, have dealt with these issues. There's a number of mothers and some of young children, and this is their life of juggling juggling work, juggling home, and making sure that their kids are in quality schools and quality daycare.
Thanks, Mandy. Representative, the other area that anytime it comes up, whether you're a Republican or a Democrat, a senator or a representative, you, along with Representative Mead, are seen as the architects for child welfare reform. In our recent Kids Count release, there was a lot of green arrows showing improvement. An arena where it was all red arrows tended to be child welfare, whether it was the number of kids being abused and neglected, the number of children in foster care, a failure to reunify kids and families. So lots of activity, lots of work. Right now, not a lot of results. I know there are so many issues. The president mentioned one, workforce. Again, that common ground where you really are seen as a leader. What are you thinking when it comes to child welfare reform as 2022 opens?
I've been having some discussions and been giving a lot of thought to how the model is working right now. With the new, I guess it's not so new, but with the Family First legislation on the federal level, where we are for the first time able to start doing interventions earlier before children come into state custody. I'm hopeful that that's going to show us less kids going into state custody, less kids in residential care. But I'm also concerned about how the business model for those the providers that do residential care. I'm very concerned about that because it was a model for many years that was built on quantity. So as we get less kids in that system, which is a good thing, we have to make sure that that system is still solid and strong for those kids that do absolutely need that kind of care. So I've been in conversations both with colleagues and with providers about how do we change that business model, that payment model, to make sure that only kids that absolutely need to be in residential care are there, but that is a strong system to give them what they need if they do need to be there. So I've been thinking a lot about that. I was so heartened to hear President Stivers talk about the need to look at the workforce. And, I've been hearing from CPS workers all across the state, but especially in Jefferson County, about we don't have enough, we don't pay well. And there are some things that we could do beyond pay to help them. I worked for many years, as you know, in rape crisis. And, when you're out all night dealing with someone who's been sexually assaulted, and I used to have to then go back to work at 8 o'clock the next morning, it was really, really tough. So we have seen our social workers on the state level deal with horrendous things, but then still have to be back at work the next day. So I'm really interested in looking at trauma-informed workplaces for them, that when they've had a traumatic, terrible case, that there is some mental health time for them and services for them. I think that could go a long way in helping our social workers, but they're just not paid enough, and we cannot attract the best of the best. We have great people who continue to work there, but boy, they are getting burnt out, and we need to step in. So I was really glad to hear President Stivers talk about that as one of the priorities.
Yeah, thank you. So let me follow up on one particular aspect of that, and I'm sure there's a lot of folks on this call who would be interested. The way my screen works, Micah happens to be right next to you, so I bet he's interested in this. I have heard when the issue of privatization comes up, I have heard the General Assembly is ready to go big, to go little, or to go not at all. From your perspective as a resident expert, but also representing your caucus, where's your head and heart on the role of privatization in child welfare?
Well, I think we need to be very cautious. I think child welfare should never be based on the bottom line of profits and that sort of thing. But the system we have right now is not working as well as it could. So I'm interested in hearing from all the stakeholders about this. I think if we go, we need to be very cautious in this. So I guess I'm more on the not at all or go small.
Okay. Another question that I know, again, historically, you have been such a thoughtful voice on is that issue of economic well-being. One of the things that we're hoping for, and I'm wondering if you think there's an appetite for this, there seem to be some very viable common agenda tax possibilities on the table. Things like, we know that, for instance, the child tax credit that is coming out of DC affects 93% of kids in Kentucky. It has the potential to eliminate 49% of child poverty. Just that one idea, very bipartisan, coming out of DC. For years, we've talked about the power of a state earned income tax credit, an idea that Ronald Reagan, Bill Clinton, George W. Bush, and Barack Obama all supported. So along with broader areas, not conceptually, but pragmatically, do you see the House and Senate being able to move in tax measures as we go into a biennial budget that might help eradicate childhood poverty across the Commonwealth?
I would love to see that. We have a work group within our caucus. We have several work groups, but one of our work groups is tax reform. And, what we saw, I think, through the pandemic is putting more money in the pockets of middle and lower income people really stimulated our economy in a time that we did not anticipate that. And what we know from studies in other states is that when you have an earned income tax credit, especially for working parents, we see greater outcomes for their children, which was educational. And so, which I thought was astounding, and I would have never have thought of that. But studies show that when working families, especially middle and lower income, have more money, disposable income, their kids do better. So, I'm a big proponent of that. I think, we have, the last couple of years have kind of been the great experiment in a lot of things for us. And, it taught me that trickle-down economy doesn't really work for most people, but putting more money in the pockets of more Kentuckians gives us better outcomes. It makes us stronger communities, but it also is a great thing for kids.
Yeah, that's great. Thanks. So as we think about the 2022 session, I want to give you sort of the same shot that I gave the Senate president. If there was a Joni Jenkins pet priority for kids, something that and you may have already touched on it, but as you go in, you're getting ready to meet with your caucus. Is there something that really down deep in that big heart of yours that you hope, man, 2022 is the year to get this done for kids? What is that?
Well, 22 is going to be a budget year. So I am hopeful, as we are looking at budget surpluses, that we make big investments in kids. I hope we fund education and higher education. We've had great economic announcements. The future looks really bright, but we have to make sure that we are shoring that up. I am still very concerned about the substance use disorder problems we have in Kentucky, and I think that affects kids on a big, big basis. So glad to see Jennifer on here and all the great work that BOA is doing around families and SUD. In fact, President Stivers and I have talked a lot about the issue of addiction, both in Eastern Kentucky and Jefferson County, and are hoping to find time to put our heads together to talk about that issue. There's a lot to do in 60 days, but I'm hoping that we will keep working parents and kids at the forefront of those discussions.
Thanks. Well, Leader Jenkins, I hope, how much I appreciate you in the midst of redistricting and road funds and all those other issues. We know that we can count on you to keep kids the focus. So thanks for joining us. Before I kick to Mehek to kind of give us an objective look at where we're headed on the blueprint, I just have one final thing to say to you, Leader Jenkins. You look really good in red rather than your normal color. That's all I'm going to say. So
just for you today.
Before you can respond, Mehek, you take it away.
Bye, guys.
Thanks.
Bye. Thank you so much. Hello, everyone. I am going to share my screen in a second so you guys could see. Hopefully, everyone could see our 2022 state policy budget priorities for the Blueprint for Kentucky's Children. And as you all probably know, the Blueprint for Kentucky's Children is a coalition of nonprofit, public, and private organizations that stand on 3 pillars. Thriving communities launch strong families launch successful kids, and successful kids launch a prosperous future for Kentucky. Let's see if I can go to the next slide. There we go. And so to kick off our policy priorities, I want to first start off with a carryover legislation, which is removing a 25-year-old state policy that would really, our goal is to allow cities and county government the option to regulate the use, display, and sale and distribution of tobacco products, including e-cigarettes, to curb tobacco use among youth. This policy has a legislative sponsor. Senator Hornback will be our legislative sponsor for this year. Moving on, we want to build on the success of successful conversations that the state was having last year around paid family leave. And we hope to create an infrastructure so parents can access 12 weeks of paid family leave for the birth or adoption of a child. Moving on, parental incarceration is an adverse childhood experience that has been referred to as a shared sentence due to the short and long-term health effects that it has on children. And so in order to really prevent that adverse childhood experience for children, we're looking into policies that utilize community-based sentencing alternatives that promote both rehabilitation and accountability while factoring in whether a person is a primary caregiver, so parents can continue to provide for their children. This is a model that Tennessee actually has emulated and put into statute, and we're looking to do so here this year as well. And then this is a policy that you've heard President Stivers talk about, as well as Jennifer Hancock talk about as well. Right now, children as young as 5- and 6-year-olds can be arrested and sent to court, and we're hoping to establish a minimum age of at least 12 years old that children could be charged with an offense, instead of sending them through the juvenile justice system and connect them to community-based services. Next, really, we hope to continue to build upon and strengthen the efforts of supporting children who have experienced abuse and neglect. And we're looking to do so in three policy solutions. One is eliminating the chain of command reporting procedures with public and private agencies to ensure any disclosure of abuse are reported accurately, timely, and directly to the proper authorities. Additionally, we're hoping to close the gap in state law that allows agencies to report a suspected incidence of child abuse and neglect by an employee of reporting agencies internally rather than external agency. And lastly, we would like to include a clarification requiring coroners to notify within a 48-hour window and gather necessary information for law enforcement, Department for Community Services, and local health departments upon the notification of a death of a child under the age of 18. Looking ahead, Kentucky can take steps to remove barriers to permanently leaving an abusive relationship and promote the well-being and financial stability of survivors of domestic violence and their children by ensuring unemployment insurance is available to survivors of domestic violence, sexual assault, and stalking if their reasoning for not working is directly related to their experience of abuse, assault, or stalking. And this is actually pre-filed by Senator Kulkarni and, Representative Kulkarni. I just promoted her there for a second, but Representative Kulkarni and Representative Heverin. And now we're going to move on to our budget investments. So we could definitely, as a state, ensure children and families continue the access to healthcare and services they need. We've, as a state, had 96% of covered children through our Medicaid, thanks to our Medicaid and CHIP program. But there is a lack of coverage for Latinx children in particular. And so we hope this upcoming year we are bolstering investments for closing that remaining gap of health coverage for Latinx children. Additionally, through the American Rescue Plan, states have the option to expand postpartum health coverage for women up to 12 months in April 2022. And we hope our state increases Medicaid funding so that way we can offer that coverage to pregnant mothers. And lastly, in order to curb our use of tobacco products, we hope that the state also bolsters investments around tobacco use prevention and cessation. And when we're looking into investing in education and well-being of every student, we are hoping to increase funding for Friskies, who are our family resource and youth service centers who are working to remove barriers to student learning. And they've been a critical resource and lifeline throughout this pandemic. And last year, our General Assembly has funded full-day kindergarten as an investment in early childhood outcomes. And we hope that the General Assembly continues funding for this upcoming biennial budget. And then we hope to increase per pupil funding, which is seek to ensure public schools can keep students from learning. And then lastly, we know in order to have a strong support for students and their mental health needs, we need school-based health providers. And in order to attract school-based health providers, we need to increase funding for those providers as well as access to those services. And as we continue looking at both investments in programs that serve victims of child maltreatment, we must expand investments in child abuse forensic services. Currently, the 2 medical schools and 15 child advocacy centers are providing critical services for families and children who are experiencing maltreatment, and we must ensure that investment is expanded in the upcoming budget. And additionally, current reimbursements are not adequate for the complex medical exams that are provided and necessary for pediatric assault, sexual assault victims. And we must increase reimbursement rate for the pediatric sexual abuse forensics examinations. And as we move into looking at our hands funding, we want to protect that funding because we know that's a critical service that's available and utilized by new parents across the state. And as we continue, we know that the DCBS staff turnover is costly to our state, and we must bolster investments in the DCBS workforce to improve outcomes for our most vulnerable children and families. And I think we've already heard from our conversation with Representative Joni Jenkins and Mandy about how childcare is an important source, not only for our parents to enter the workforce, but also to stay in the workforce. And so we must build an infrastructure that improves access to affordable, high quality care. And again, the last budget priority that we are looking to focus our attention on in this upcoming General Assembly is to protect the current funding for safety net programs, including KTAB, SNAP, WIC, and ensure that they're not modified in any ways that prevent children from receiving and needing services. These safety net programs play a critical role in making sure families who are struggling really could meet those basic needs that they have. And that's not all. We're also working on administrative policies this upcoming year. So as we are looking at several policy priorities, these two administrative policies are on our blueprint for Kentucky's children. And with that being said, I am now gonna stop sharing my screen and turn it over to Courtney to wrap us up.
All right, thanks, Meg. And thank you to each of our panelists and all of the advocates for joining us today. As always, we also want to thank Aetna Better Health of Kentucky for their support of today's Advocate Virtual Forum. To see the complete list of Blueprint policy priorities and the budget checklist that Mehek just went through, please visit our website. The link is already in the chat, and then we will also provide it in a follow-up email to everyone. And while you're on the site, please remember to register for Children's Advocacy Week, which will be on January 18th through the 21st next year. So this is going to be our last forum of 2021. Be on the lookout for a survey in our follow-up email. We would love to hear from you all as advocates for Kentucky's kids about which issues or topics you want to hear more about in each of our 2022 Advocate Virtual Forums. So thank you all again for joining us today. Have a great rest of your day and happy holidays as well.